Thanks for joining me on Menopause Unscripted. Remember, the change is just another beginning.
Hi, besties. We're inviting you to join us at Period Besties podcast, where nothing is TMI. Join Katie and Stasha, where we talk about everything from periods to menopause and all the messy stuff in between. You'll learn, you'll laugh, you'll want to invite your bestie. So grab a cuppa and join us every Tuesday wherever you listen to podcasts.
Welcome to this week's episode of Menopause Unscripted. I would love to welcome back Liz Frey from Fringe Heals. Liz, for people who didn't see or maybe haven't gone back to watch the pre-existing episode that you were on with me, could you please tell people very quickly a little bit about yourself?
Sure thing. So thanks for having me on again, Heidi. I'm Liz, and I'm a pelvic health physiotherapist up in Canada. I'm also the Women's Health Medical Director at Fringe, a company that is passionate about developing products to help everybody, but also specifically my area of expertise, like helping women with all different health issues.
Thank you for that. Now, last time you were on, we were very, very broad in terms of talking about all of the different ways that red light therapy, blue light, and infrared can help someone's body. But can I ask you to tell us a little bit more specifically about your area of expertise and about how we could be using light therapies for the pelvic area?
Yeah, for sure. So as a public health therapist, my main focus is women's pelvises. So looking at vaginal and rectal conditions, every individual from essentially puberty or more often in my practice from pregnancy right through menopause and beyond. So light therapy is really valuable in my practice because we can capture the benefits of light therapy in various ways using a wrap, using a pelvic wand, and I can speak to both of them to help the tissues and the whole vaginal microbiome. When we look at light, and we did this in our last episode, the
Mhm.
the three wavelengths of light that are really important for our bodies and for tissue health and healing are red light, near infrared light, and blue light. And so the red and blue light are part of the visual spectrum of light that we would get from the sun, for example, and be able to see visually. Whereas near infrared light, we can't see it, but we definitely can still harness the health benefits of it. So what we've done at Fringe is we have captured light therapy. I'll turn on this pelvic wand so people can see. And we
The
have,
glowing.
yeah, we've developed the pelvic wand. So there are three modes of light, as you can guess. There's red and near infrared, which I have on now. Then there's blue light, and then there is a red light only, which looks the same as the first one because the near infrared light, of course, is not visually, you can't see it essentially. So the benefits of using, I'll say red and near infrared, it's easier to speak about both of them together. Really, the only difference there is that the near infrared penetrates deeper than the red light therapy, but they have overlapping benefits. I'd say the five biggest, yeah, more, I'd say biggest benefits with using light therapy would be for an increased production of ATP, which is energy at a cellular level. So what happens is our tissues will absorb light, and then there's a whole cascade of reactions that occur at the level of the mitochondria. And one of the byproducts of that cascade of reactions is ATP, which is energy. So you'll have an increase in cellular energy.
And
Another
what does that do for us? Like that increase in energy, I just want to interrupt, sorry for just a second.
Yeah,
What
go
does
for it.
that do? Because people probably remember, at least here down here in the States, remember like talking about how like the mitochondria is like the cell's battery. But when we increase that energy, what does that do for us?
Well, you could use, your cells can use energy essentially for, you can think of anything like just being healthier,
Hmm.
tissue healing, tissue recovery, increase energy for even if you think about like performance, uh, increase or reduced inflammation, reducing pain. Like the list really does go on. Like I think of having more energy in general for cellular reaction.
Okay.
Yeah.
Sorry to interrupt. I'll let you keep going. I just was like, let's stop for 1 second.
Totally. So then another byproduct of this reaction at the mitochondrial level is nitric oxide. And nitric
Okay.
oxide is a really powerful vasodilator. So if we have vasodilation to the local tissues receiving light, then you're going to have increase in blood flow, which brings oxygen and nutrients, again, for tissue health, healing, reducing inflammation, reducing congestion, etc., right?
Okay.
So those are two big benefits with this cascade of reactions that happen at the mitochondrial level. And then the other three, because I said I'd name five big
Hmm.
things, are an increase in elastin and collagen production. And
Okay.
elastin and collagen are really the building blocks of our cells, right? So a lot of there's been a lot of hype recently with using red light face masks. And so you can think of the same, this is sort of an analogy, but using them to reduce fine lines and wrinkles and increase the integrity of our tissue so that we don't have as much sort of drooping and sagging, really, right? So you could think of the same thing for the pelvis if you have a lot of pelvic atrophy or tissue, like fragile tissues, which we see when in situations of low estrogen, like postpartum or with menopause, then increasing the elastin and collagen production will help with that tissue integrity. And then the last two are reducing inflammation and congestion, which I've already mentioned, and then reducing pain. So, like at a neural level, your nerves won't be as irritated and inflamed, and therefore have less pain. So,
Okay.
those are my big five reasons that I would suggest light therapy to women in my practice.
Bouncing back to the nitric oxide, because we hear a lot about that in menopausal health in terms of cardiovascular health. But
Mhm.
the reduction in nitric oxide, when we have a reduction in our hormones during like hormonal chaos through perimenopause and menopause, and could only assume that we'd have a nitric oxide reduction during that low estrogen period after pregnancy. Is that part of why women experience dryness with that loss of estrogen and that reduction in nitric oxide? Do those go hand in hand?
Yeah, so the loss of estrogen, as you said, postpartum or
Hmm.
during menopause, definitely is um, associated with a reduction in blood flow. So if we can increase blood flow, generally we increase secretions, which is increasing moisture to the vaginal area, which helps obviously with lubrication for intercourse, or just being more lubricated, period. Women who have a really like dry vaginal environment can also develop little fissures. They can have just irritation, burning, itching kind of feeling. So having an increase in blood flow, which increases secretions, will really help with that.
Okay. I was having busy over here having this like aha moment, like tying nitric oxide and vaginal dryness and heart health together. So like don't mind me. I was over here like having my own little spiral going.
Very good.
Oh, okay. So let's go back to the wand and the wraps. Okay, and you're just showing us the wand, but can we talk about how in your practice you use this for this group of people going from pregnancy through perimenopause? Because I see a lot of this as well. And a lot of women who are coming to see me with pregnancies, maybe in their 40s, and maybe we're kind of bouncing back and forth between pregnancy, doing some sort of assisted fertility, hormonal chaos, and we're kind of spiraling. So, how could this help us during that specific time in transition?
Mhm. So definitely you've named the two populations that I recommend using light therapy for, like most often in my practice as well. So postpartum, depending on how the birth like proceeded, if there is vaginal tearing, grazing, or episiotomy, as well as C-section, I don't want to leave that out because you can use the wand just externally as well
Okay.
as internally, right? So if you
Like a
have
little external C-section massage with your wand.
yeah, but you actually,
Okay,
if you look at the like nice little arc of the wand, it
sure.
does follow essentially a C-section scar. So
It
even
really does.
yeah, totally. So it does. I mean, that's not what it was exactly designed for, obviously, but it does fit well, as do the wraps. So for
Okay.
my Postpartum population, I'm really focusing on wound healing, if that's
Okay.
applicable. And so I recommend women to use the wand externally, like just along the vulva, for the period from birth to being essentially cleared by their OB or midwife or whoever to have an internal application, right?
Okay.
So external at first and then internal as allowed or directed and as comfortable, of course.
Sure.
Right? And my primary objective usually there is for getting increase in blood flow, which is oxygen and nutrients for tissue healing. That's what I think of. It'll also help with congestion if someone's really feeling swollen and having a lot of pain in that environment. So
Okay.
that would be my initial rationale for using the wand.
Okay.
After healing has sort of progressed and the woman is, maybe a month, 2 months postpartum, we can start to say, okay, well, what is the integrity of the tissues? Are you just as strong as you were prior to giving birth? And that's where often women will be complaining of symptoms of maybe prolapse, maybe some incontinence that they didn't experience before, et cetera, et cetera. So that's where actually we haven't mentioned it, but the wand has 4 different levels of vibration in addition
Okay.
to the light therapy. And that's where I'll start to stack my therapies. So
Okay.
if someone has low pelvic tone, and that would be if they have prolapse, if they feel like there's atrophy, if they're having stress urinary incontinence, which is when they sneeze and cough and laugh and are like, oh, wait, what just happened,
Yep.
right? And they have maybe a little bit of leakage, then that's when we'll say, okay, wait a minute, let's get light therapy so we can increase blood flow, increase collagen and elastin production, increase the ATP energy of the cells for healing and reproduction, or like I should say, multiplying and growing muscle, if you will. But then let's also add in some vibration. So with the 4 different levels, I usually would target the top 2 levels, the more aggressive levels of vibration in the wand to help the brain and the muscles connect, right? Often, if there has been a trauma, like birth, um,
Hmm.
then your brain's ability to connect with your pelvic floor muscles can really be hampered. So if we can have a little bit of vibration, and we do this even externally, if someone's had an injury, we kind of tap as therapists,
Hmm.
tap the muscle, say, here, this is what we're trying to target. So if we can use the pelvic wand essentially internally to vibrate the tissues, the brain will say, oh, those muscles, right.
Yeah.
So we can pair all the benefits of light therapy and stack it with vibrational therapy. And then, of course, all the amazing things that we do as public health therapists, where we're cueing women with strengthening exercises, we're cueing them with posture, we're cueing them with like so many
Hmm.
other things that will help them on that journey. So
But
that's
this could be a great adjunct tool to like all of those other things.
yeah, and I think that's it's important you note that as an adjunct tool. So it doesn't replace any of the like the benefits or the services that we offer as public health therapists. I'll say pitch this essentially to my clients though as a home therapy tool, right?
Hmm.
I know some therapists do use it in clinic and they can use like a sleeve, like a medical grade sleeve over top of it for sanitary purposes. For me and the way my practice operates, I will do all of my education, my pelvic health therapy, and then I'll say, you know what, you might really benefit from using this wand at home. And then my clients generally will purchase a wand so that they can use it, in the comfort of their own home. And I think that's important to note because for best or optimal results, we do recommend using the wand 3 to 5 times a week for about 10 minutes. And that's because the LED light, we've designed the wand with a number of chips and irradiance, like energy that's coming from the lights for 10 minutes, and that is like an optimal dose,
Okay.
right? So it's not a one and done, it's not laser, it's LED light therapy. So that's I think an important thing to know.
I think that that's super important because people are always looking for a quick fix, right? And this isn't a quick fix. And even like a laser, like if you're in a clinic, like, we're not using like a CO2 fractional laser on these women, but like, laser type therapy when you're coming into the clinic and you're doing this maybe for an orthopedic injury, that's not a one and done thing either. It's an adjunct for healing to what we're doing, but it's
Mhm.
certainly not a quick fix.
No.
And I do the same as you, where I make it as part of a home therapy. And I guess the only thing I do with it in clinic really is if a patient purchases one, as I ask them to bring it in maybe one time, so we can walk through how to, to use it for like best purposes. And then they feel it kind of that barrier to entry. They feel like they are more confident in using it at home. So it doesn't just sit on the nightstand and do nothing.
I will do that too. Some people, while I say optimal dosage is 10
Mhm.
minutes, 3 to 5 times a week, some people will start really slow and low, very gradual, like
Yeah.
depending on their condition, right? So we actually have a mode, and you can see it here where that's full mode, and then that's half light, right? So
Okay.
you can kind of toggle between it. So some people that are really sensitive, their tissues might be sensitive to light. Um, then I'll say, hey, let's just start off on the 50% mode versus full light. And some other people I'll say, hey, you know what, let's not start with 10 minutes. Let's start with 5 and then gradually build up. So I can kind of taper the actual, I'll say protocol or home therapy given their condition. So I think that's important to note as well. Yeah, it's not always 10 minutes.
Yeah, it's like everyone's, we have to moderate for the patient. So
Yeah.
when would you recommend the blue light is compared to the red and near infrared for what
Yeah, good
conditions?
question. Good question. So when we look at red and near infrared, I would recommend that most often. That would be
Okay.
my like kind of let's say most clients. I would recommend just red, the mode 3, for clients that might be sensitive to the gentle warmth. Like there's a gentle heat that comes from the
Mhm.
near infrared. So mode 3 is just red. So there is no heat generated. So that's where I would recommend red. Now, blue light, which was your question. I just wanted to go through the all three. Yeah.
Totally
So
fine.
yeah, you got it. So blue light therapy is really amazing for the health of the vaginal microbiome. So it helps reduce like fungal, bacterial, like infection essentially. And I would say in my menopausal population, that's where I see the greatest increase in like infection, essentially, bacterial vaginosis, candida, that kind of thing. And so I will recommend using blue light for that population. It will just help balance the pH, help the integrity of the microbiome. So when I do recommend it, I recommend using blue light for 5 to 10 minutes, depending on the client, but then following it with the red light therapy or red near infrared, again, depending on the client, for the tissue health. So it's still like we're helping the pH, we're helping the microbiome, but then hey, let's also help the tissues with all the benefits I mentioned from the red and near infrared. So I really do like to stack the blue with red.
So can we just take one quick step back and talk about like why someone who's like in a menopausal population, why they may have more problems with pH, yeast, candida, BV. Can we just talk about for a second like why that happens so that people may kind of go, oh, that might be me, if they didn't know that that might be them?
Yeah, well, when there's a reduction, essentially a reduction in estrogen, um, I'd say all of our systems are hampered. That's why I think about it, right?
It is.
Yeah, so unfortunately,
Brain.
so when we're looking at our like good bacteria
Mhm.
versus our like I'll say bad but negative bacteria, there is a really challenged environment for the good bacteria to essentially outweigh the bad. And so we'll have like a yeah, teeter-totter effect really where it is harder to maintain lactobacillus, the good bacteria relative to the bad, and then we will have an increase in infection, essentially, more
Okay.
susceptible to it. Yeah.
We've talked a lot about the wand, but you had mentioned at the beginning about the wraps. And this is a joint wrap that I have with me. Okay. And so you can see this has kind of a funky shape. But can we talk for just a second about when you might recommend a wrap as opposed to the wand or in conjunction with the wand? So we've got something that's more external.
Yeah, for sure. So I will the wraps are amazing. They have red and near infrared light in them. They don't have the blue light, so keep that in mind. But I
Okay.
would recommend the wrap most often to women that have um, lower abdominal, let's say, congestion, symptoms, issues. So it could be interstitial cystitis, it could be endometriosis, PCOS, menstrual cramps, anything where you can think of kind of that whole lower abdominal area feeling crappy, really, right?
Okay.
So like
Perfect way
that
to put
was
it. Just
bottom
feeling
line.
crappy. I like it.
Yeah. So that's where I will refer for the wrap. And
Okay.
also, if there's a woman out there that's saying, "Oh my gosh, I think I need the wand would benefit me. I'm just not ready to take that step."
Hmm.
You recognize you can use the wand externally or internally, but if someone's looking for more of like, let's say like an entry product where they're not looking for something vaginal yet,
Hmm.
then the wrap is a phenomenal starting point just to
Okay.
familiarize yourself with red light and the benefits. And then some people will use the wrap and the wand together, right? So that we're kind of targeting the tissues internally as well as externally. Other people just use one or the other. But that's when I really refer for using or like recommend, I should say, using the wrap
Okay.
versus the wand. Yeah.
So let's keep going and let's move on from like the pregnancy kind of
Mhm.
perimenopausal woman to the menopausal. So could you give me kind of like your top three reasons you might use red light therapy with a menopausal woman? And maybe we can kind of talk and kind of keep this specifically to the pelvis because we could get
Yes.
very broad again with this.
Totally. When I think of my menopausal population and what they're coming to see me as a public health therapist for, I would say one would be pelvic pain. So that could be the thinning of their tissues, and their tissues are feeling a lot more fragile and irritable, but it could also be hypertonicity. So they could be, maybe there's like a lot of stress in their life. Maybe they're just like a holding pattern kind of person, in addition to the tissue discomfort. So I will use the wand on the red near infrared light setting, or I'll recommend it to them. And then I'll also recommend the really low vibration setting. And when I say
Okay.
low, we're talking like really gentle vibration. And I recommend that because gentle vibration helps relax tissues. So if we can target an increase in blood flow, increase in secretions and lubrication, etc., with the light therapy, and then help relax the muscles with the gentle vibration, then that's a huge win. I'll most often recommend this for my menopausal women who still really want to engage in intercourse but find it painful. So there's this kind of clenching or tightening of the muscles just in anticipation of intercourse, as well as their sort of thinning of their tissues. So if they use the wand as, I'm going to call it a warm up, but prior to intercourse, then I've seen phenomenal results with that. So that would be one. You asked for three. That would be
Hmm.
one of
Yep.
my menopausal conditions that I see and how I would use the wand or recommend it for women for home use. Another one would be the opposite end of the spectrum, where women come in and they're like, I don't know what's happening, but I feel like something is falling out, right? Things are not where they're supposed to be. I feel a bulge. I feel heaviness. I feel congestion. And those are symptoms, generally speaking, of prolapse. So that is when the organs descend into sort of the vaginal canal and can even come out, depending on how severe the prolapse is. And so I say that was the opposite end of the spectrum because usually there's a lot of tissue atrophy, muscular wasting away that's happened, and a lot of weakness essentially in the pelvic floor muscles for these women. So I will use similar to what we talked about with the postpartum population when we're trying to develop strength, but I will use the
Hmm.
higher levels of vibration combined with the benefits of the light therapy and a lot of cueing and strengthening exercises for these women to help, I'll say, reduce the symptoms of prolapse. I'm not going to claim that we're going to completely reverse a prolapse, which I wouldn't with or without light therapy. I would never
Hmm.
sort of make that claim, but we can definitely reduce the symptoms those feelings of prolapse, when we combine using the light therapy and vibration therapy with home exercises, with education on posture, lifting techniques, um,
Toileting.
yeah, planning and pacing throughout the day and not being on your feet all day and doing heavy lifting, all the things that we already recommend as pelvic health therapists, but definitely combining the light therapy and the vibration setting are a fantastic like adjunct to what we're already doing to help the women who are feeling like weak and having prolapse. And I would say the third sort of menopausal condition that women come in with is definitely incontinence. The stress urinary incontinence is the one that I see in my practice most often, and sort of along the same vein as the prolapse. We would be wanting to work on strengthening the pelvic floor muscles and helping develop the connection between the brain and the pelvic floor muscles. So sometimes it's more of a timing thing where we're like, oh, I've got to go, and oh no, I just dribbled, right? So if we can
Yeah.
get timing of the pelvic floor muscles and strength and help increase the, I'll say the plumpness, but the muscular integrity of the tissues with light therapy, then that is definitely going to be beneficial when we're thinking about sort of the rehab and trying not to have urinary incontinence. So those would be my top three, but I think I could go on forever. There's a lot of other ones, right? But
I was gonna
those are
say,
three.
do you have another couple
Yeah.
that you think would really
Well,
see?
the blue light therapy, which
Hmm.
we've sort of already discussed. I think that would be my number four, where women are coming in and they're just feeling like a lot more irritation of their tissues, and they're not sure if it's infection or if it's just the thinning of their tissues. They feel like they do have a little bit more like yeast, if you will, that kind of
Hmm.
thing. And so that's when I was like, okay, honestly, blue light therapy, like it's I don't want to say it's a no-brainer, but it really is like the research is so compelling. It is very clear the blue light therapy helps. In fact, you'll see it in a lot of the face masks that are on the market, where there, and our face mask also has blue light therapy because it really helps with acne. So think about like sort of that bacterial sort of acne, then it can help with that as well. So we're seeing sort of the same thing pelvis as we are face, right?
So with that being said, lichen sclerosis,
Hmm.
I don't see a ton of it, but you do see it. So is that something you could be using the blue light for therapy for as well?
Such a good question. And it's interesting you mentioned that you don't see a lot of in practice because I
Hmm.
didn't see a lot of it either, but we have an overwhelming number of questions in our like DMs or even just people reaching out to us at Fringe who have lichen sclerosis and wondering if the wand will be helpful. And so I say yes, for sure, because what we can do is we can reduce the irritation. We're not going to change the fact that you have lichen sclerosis, right? But what we can do is we can reduce the tissue irritation. There's often like itching, burning, tension, like kind of connective tissue tension, etc., with lichens that make things very uncomfortable down there. So using the red and near infrared light therapy can really help with the symptoms, not curing the condition itself. Yeah,
Right. Is that the same with lichen planus as well?
I'm not sure.
Okay. I asked that only because I was checked for lichen sclerosis last year,
Okay.
and my doctor also checked me for lichen planus. Thankfully, I don't have either, but I've never seen lichen planus in clinic, and it's not something
Nope.
I get questions about often, but I just thought I'd see if you did.
Yeah, that's right. No, I'd really have to look at the research to make sure. I
Okay.
would say maybe, but
Okay.
like depending on what the symptoms are and sort of what the root cause of it is, then whether or not light therapy would be applicable.
Okay. So my
Yeah.
third question is, and there might not be any research on this, but I get questions all the time, mostly from girlfriends who send me scary things they see on TikTok about do you get these from friends where it's like they see something terrifying on TikTok and for whatever reason I'm the answer for all of them and it
Yeah.
doesn't have to be anything that's semi-conscious. But
Mhm.
one of them is the TikTok that goes around about losing your labia minora and how your inner lips disappear. Could this possibly help to keep us from losing our inner lips? Like I said, there's probably no research, but like
Yeah.
clinically, do you think that this could help?
I think that's a really interesting question, and I don't think we could turn to the research for it yet.
I don't think there's
Like, I
any.
haven't looked at it. I haven't looked at it, so I
Hmm.
don't want to say we can't. But I highly doubt there's some awesome, systematic reviews or randomized control trials on light therapy for labia minora, right?
Can
Um,
you imagine the title of the
just
study?
saying. Just saying. Um,
I just like I had to ask. They're talking about external conditions.
Yeah, but when I think about it like rationally and like what the benefits of light
Yeah.
therapy are, I would say I don't know that we could reverse it or like not even reverse it, but say make it not happen at all. Because if this is like more of a like autoimmune condition or a yeah, like that kind of a thing that's happening, we
Because
can't.
isn't it mostly like like a loss of estrogenation, like where those tissues just lose their plumpness?
No, I think it's more of a autoimmune condition like lichen
Okay.
sclerosis where we see such a reduction of the tissues. I think we would see
Okay.
a wasting away
Hmm.
with estrogen, but not a they're gone altogether, right?
Okay.
That's my impression. And that's what I see clinically, to be honest. Um, so I think that the benefits of light therapy would be more for maintaining the plumpness, maintaining the tissue elasticity and integrity. But I don't know if there was a condition at the root cause of it. I don't think that we could say that light therapy is going to.
Fix it.
Yeah, exactly,
Okay.
exactly.
Because I feel like we have canvassed kind of the overarching topics having to do with recovery from pregnancy into postpartum, perimenopause. And I want all these women here that are might be listening to this. I love that you just like made yourself glow again. Like this topic, like this pregnancy to perimenopause, like women just, I think, are not hearing enough about this area of like healing and that we can be experiencing these two things kind of simultaneously. Would you agree?
Yes, absolutely. Yeah.
And we also talked a little bit about the top conditions why you might want to use light therapy if you are menopausal. So I just want to thank you again and for being here. And I hope you'll come back because we have so many more conditions to cover. And red light therapy, blue light, all of the lights are one of my favorite topics conversationally. And I love your expertise. So thank you again for being here. And can I just ask you, do you have one final thought for our audience?
Yeah, well, thanks for having me. One final thought for sure. So I would say that if you are postpartum or perimenopausal, menopausal, like anywhere on this journey, and you are feeling that you have symptoms of any of the conditions we talked about, but generally would like to have a, like I'll say, healthier microbiome, more plump tissues within the vagina, and a stronger, healthier pelvis as a whole, then light therapy might be a really good adjunct therapy to what you're already experiencing and doing with your healthcare practitioner. So thanks, but I think that would be my final words.
I love it. And I'm probably going to say plump about 20 more times today.
Seriously.
So if you like this conversation here, please like, follow, and subscribe us on for with us on all of our channels, where you can find Liz and where you can find Fringe Heals. It'll all be in our show notes. So don't worry, you can find everything we talked about today, including Liz, if you've got additional questions you want to DM her. So do your thing, people. Like, follow, and subscribe, and we will see you next week. Thank you again. Now, I have to end with the boring stuff. While I am a doctor, I am not your doctor. This podcast is for entertainment and educational purposes only. If something in today's episode resonated with you, please bring this to your own healthcare team and self-advocate. We always are promoting that. I cannot wait for you to join me on next week's episode of Menopause Unscripted for another hot topic.